We often worry about the obvious health threats, the big ones. But sometimes the really sneaky risks are hiding right under our noses. Or, well, under our pet's paws even,
Yeah.
like in the soil.
Exactly. It's amazing what's in our everyday environment.
So today, we're going to dig into something kind of surprising in pet health. How ordinary soil can actually harbor bacteria that cause a serious, though thankfully uncommon, infection in dogs and cats.
That's right. We're talking about nocardiosis. It's caused by Nocardia bacteria, which, as you said, live naturally in the soil.
And we're basing this deep dive on the paper Canine and Feline Nocardiosis Management. Our aim here is to pull out the really crucial bits, the stuff you need to know without getting bogged down in, excessive jargon.
Yeah, distill it down to the essentials, give you a solid understanding of what this is all about.
So whether you own a pet, or maybe you work with animals, or you're just, well, curious about health stuff, we think you'll find this fascinating. We'll cover how these bacteria actually get in, the different ways the infection can look, which animals might be more at risk, how vets figure it out,
Diagnosis.
and of course the basics of treatment. Okay, so first things first. These Nocardia bacteria, what's their deal?
Okay, so these bacteria, the culprits here, are what scientists call saprophytes.
Saprophytes.
Which
Wow.
basically means they live on decaying organic stuff in the soil. That's their normal gig.
Okay, so how do they jump from the soil to, say, a dog or cat?
Well, there are generally two main routes this happens. The first one is wound contamination.
Makes sense. A cut, a scrape, gets dirt in it.
Exactly. Soil with nocardia gets into an open wound, and the bacteria can set up shop.
Okay, so that's one way. What's the other?
The other main route is respiratory inhalation.
Breathing it in.
Yeah. Think about a dog digging enthusiastically in the garden, or maybe a cat exploring a dusty barn or crawl space. They can inhale these tiny organisms.
Huh. So exposure might actually be pretty common then.
It probably is, relatively speaking, but whether an actual infection develops, that often really depends on the animal's immune system.
Ah, right. So it's not just about exposure, it's about vulnerability.
Precisely. If an animal's immune system is compromised for some reason, maybe another illness, certain medications, maybe just age, they're much more likely to get sick from nocardia if they're exposed.
Okay, that clicks. It's about the body's ability to fight it off. Now, are some pets more likely to get this than others, like specific breeds or...
Well, the source material we're looking at says pretty clearly that any breed of dog or cat can be affected. There's no strong breed predisposition mentioned. But interestingly, it does note that the disseminated form, the one that spreads widely through the body, seems to be most common in younger dogs.
Younger dogs. Any idea why?
The source doesn't explicitly state why, but you could speculate. Maybe their immune systems are still developing, less robust. Or perhaps it's behavioral. Younger dogs might be more likely to, dig around or get into situations where exposure happens.
Could be. And one thing that really stands out is how differently this infection can present itself. It's not just one set of symptoms, is it?
Not at all. It's really quite variable depending on where the infection primarily settles. Let's maybe start with the chest area.
Okay, the chest.
If the infection takes hold there, in the space around the lungs, it can cause something called pyothorax.
Pyothorax.
Yeah.
That sounds bad.
It is. It basically means pus building up in the chest cavity.
Oh, wow.
Yeah.
That must make it incredibly hard for them to breathe. What would you actually see?
The classic signs are difficulty breathing. Vets call it dyspnea also, significant weight loss, looking really thin, emaciated even, and usually a fever. That fluid buildup physically restricts the lungs, and the infection itself causes the fever and malaise.
Okay, so that's the chest presentation. What if it hits the skin instead?
Skin involvement looks quite different. Typically, you see chronic wounds, sores that just don't heal up properly.
Stubborn wounds.
Yeah, really persistent. And a common feature is something called fistulous tracts.
Fistulous cracks.
They're like little tunnels or passages that form under the skin, often draining pus or fluid. Not pleasant.
Doesn't sound it.
And if these skin infections go on for a while, they can get more complicated. You might see swollen lymph nodes nearby. That's lymphadenopathy. Sometimes those lymph nodes themselves start draining.
Wow.
And in really extended cases, the infection can even spread deeper into the bone underneath, causing osteomyelitis.
So it can go from skin deep to bone deep. That's serious.
It certainly can progress that way, yes.
And then there's that disseminated form you mentioned where it spreads widely. That sounds like the most worrying type.
It is often the most challenging, yes. Disseminated nocardiosis frequently starts in the respiratory tract, presumably after the bacteria were inhaled.
Okay.
The general signs you might see are pretty nonspecific initially. Lethargy, just seeming really tired and unwell, fever, weight loss again.
Think of vague. Could be lots of things.
Exactly. Though the source does mention that sometimes the fever can be sort of cyclical, coming and going in waves. That might be a subtle clue.
Interesting.
But what makes the disseminated form particularly tricky is that it can spread to the central nervous system, the brain, and spinal cord.
Oh, leading to neurological signs.
Potentially, yes. Seizures, changes in behavior, coordination problems. And on top of that, these animals might also develop fluid buildup elsewhere, like in the chest, the pyothorax we talked about, or in the abdomen. So multiple body systems can be affected.
Gosh, it really can get complicated, which must make diagnosing it a real headache sometimes. You mentioned cats earlier. Does it look different in them?
That's a good point. The source does highlight some feline specifics. In cats, nocardiosis seems particularly prone to causing either pneumonia and infection right in the lung tissue itself, or, again, pyothorax, that pus accumulation in the chest.
So often respiratory or chest-related issues in cats.
It seems that way, yes. While they can get other forms, pneumonia and pyothorax are commonly cited for feline nocardiosis.
Okay. Now, we've been saying Nocardia bacteria. Are there different kinds, different species involved?
Yes, absolutely. The source material identifies several specific species that are relevant in dogs and cats. Nocardia asteroides is a big one. It affects both species.
Okay.
Then there's Nocardia brasiliensis. Interestingly, this one seems to primarily affect cats.
There's cats for that one.
Primarily, according to this source, yes. Then you have Nocardia nova. This one was apparently more common in Australia initially, but now it's recognized in the U.S. too.
Right.
And finally, they mention Proactinomyces species, but note that these are pretty rare causes. Knowing the specific species can be helpful, sometimes guiding treatment down the line if you can identify it.
Okay, that makes sense. So, given all these different ways it can show up, and the fact it can look like other diseases, how on earth do vets actually nail the diagnosis? What's the process?
Yeah, that's a really key point. The source emphasizes diagnosis can be tricky precisely because the signs overlap with so many other conditions.
Right. Differential diagnoses?
Yeah, exactly. For those chronic skin wounds, a vet needs to think about other bacterial infections like actinomycosis, certain fungal infections like sporotrichosis, maybe atypical mycobacteria, even things like reactions to embedded foreign bodies or bite wound abscesses. Lots of possibilities.
Okay. And for the chest problems, the pyothorax?
There, they'd consider other causes of bacterial pyothorax, which can be caused by different bacteria. They'd also think about, unfortunately, thoracic neoplasia cancer in the chest, or maybe even something like a chronic diaphragmatic hernia.
Wow.
And for that really widespread, disseminated form, the differential list includes serious things like plague, other systemic fungal infections, and especially in cats, fit feline infectious peritonitis.
So it really involves a lot of careful consideration in ruling things out.
Absolutely. It's a process of elimination based on the signs and initial tests.
So what are those tests? What tools do vets actually use to try and pinpoint nocardiosis?
Well, they'll usually start with some standard diagnostics, blood work, for instance.
What might that show?
Often you'll see an increase in a type of white blood cell called neutrophils. That's neutrophilic leukocytosis. It just indicates inflammation or infection somewhere.
Okay, a general sign.
Right. And if the infection's been going on for a long time, they might see a type of anemia called non-regenerative anemia. Interestingly, the basic blood chemistry panel is often normal.
Really?
Yeah, usually. Although in very chronic cases, you might see an increase in antibodies, something called hypergammaglobulinemia. But generally, blood work gives clues, but it's not specific for nocardia.
Okay, so blood tests point towards inflammation, maybe chronic illness. What about looking inside imaging, x-rays?
Yes, imaging is definitely very useful. Depending on where the problem seems to be, x-rays can be revealing. They might show fluid in the chest or abdomen, signs of lung inflammation or consolidation suggesting pneumonia, or even changes in bones suggestive of that osteomyelitis we mentioned.
So imaging helps locate the problem and see the extent of it.
Exactly. It helps visualize the consequences of the infection.
But to actually identify the bacteria itself, you need to look at samples more directly, don't you? Under a microscope.
Absolutely. Cytology is a crucial step here.
Cytology, examining cells.
Right. This means taking samples, maybe fluid drained from the chest or abdomen using a needle, or swabs from those draining skin tracts.
Okay.
Then they stain these samples and look at them under the microscope. If it's Nocardia, you might see these characteristic gram-positive branching filamentous rods. Sometimes they look like little beads on a string, two pucky forms.
Ah, so that's pretty specific then.
It's highly suggestive, but, and this is a really important but mentioned in the source, you often can't reliably distinguish Nocardia from another type of branching bacteria called actinomyces just by looking at them under the microscope. They can look very, very similar.
Oh, I see. So similar appearance makes it tricky. Actinomyces, that causes lumpy jaw sometimes, right?
That's one manifestation, yes. So seeing those branching filaments is a big clue, points you in the right direction, but it's not definitive proof of Nocardia on its own.
Okay, so cytology gets you closer, but not all the way there. What's the gold standard then? How do you get a definite diagnosis?
The definitive diagnosis comes from culturing the organism.
Growing it in the lab.
Exactly. Taking those samples, the fluid, the tissue, the pus, and putting them onto special growth media in the lab to see if Nocardia bacteria will grow. That's considered diagnostic.
Right. If it grows, you know you've got it.
Precisely.
What about looking at tissue biopsies? Does pathology help?
It can provide more information, yes. Looking at tissue samples under the microscope, histopathology can show the pattern of inflammation. The source notes some subtle differences. N. asteroids tends to cause a more pus-filled reaction, sort of pyogranulomatous, while N. brasiliensis might cause a more distinctly granulomatous reaction with lots of fibrous tissue.
So some clues there, potentially, about the species.
Possibly subtle clues, but again, the source reiterates that even looking at the tissue architecture and the bacteria within it, you still can't definitively tell Nocardia apart from actinomyces just by appearance.
Okay, so culture really is king for confirmation.
It seems to be the most reliable way to be absolutely sure it's Nocardia and not actinomyces.
Got it. So it's a puzzle. Clinical signs, imaging, cytology for clues, but ultimately culture for the definitive answer. Okay, let's shift gears to treatment. How do you manage this once you know what you're dealing with?
Right, treatment. Well, it's usually a pretty involved and lengthy process and often requires a multi-pronged approach.
Not just a quick fix.
Definitely not. If an animal comes in really sick, maybe with that pyrothorax or abdominal fluid or the disseminated form, they'll almost certainly need to be hospitalized initially.
Makes sense, get them stabilized.
Exactly. Stabilize them, provide supportive care like intravenous fluids if they're dehydrated, and crucially, drain any significant fluid buildup from the chest or abdomen. That's often step one.
Removing that pus or fluid.
Yeah, get it out of there.
Yeah.
This helps them breathe easier and reduces the immediate burden of infection.
Okay, so initial stabilization, fluid removal. What about the longer haul?
The cornerstone of long-term treatment is antibiotic therapy, and we're talking long-term, often weeks or even months.
Weeks or months, wow.
Yes, and if there are those draining skin tracts, they'll need ongoing management too, usually on an outpatient basis once the animal is stable.
And nutrition must be important too, right, if they're losing weight?
Absolutely vital. The source really emphasizes encouraging them to eat, offering tempting, palatable foods. And if they're in the hospital and just won't eat anorectic, they might need nutritional support through a feeding tube, like an orogastric tube. They need fuel to heal.
Good point. Need the energy to fight. What about surgery? Does that fit in anywhere?
Yes, surgery definitely has a role in certain situations. It's often used alongside the antibiotics.
Okay, like what?
Well, surgical drainage can be really beneficial. For significant pyothoracx, placing a chest tube allows for continuous drainage and sometimes flushing of the chest cavity.
Ah, like a drain.
Exactly. And for those chronic skin lesions with draining tracts or involved lymph nodes, surgery to open them up, clean out dead tissue, that's called debridement, and establish drainage can really help the antibiotics penetrate and work better.
And maybe look for foreign bodies too.
Good point. Yes.
Yeah.
If there's suspicion that maybe a splinter or a grass-on kicked off the infection in the skin, surgery allows the vet to explore and remove it if found.
Okay, so surgery is often supportive, helping the medical therapy work better. Let's talk meds then. The antibiotics. What works against Nocardia?
Well, the ideal scenario, as the source stresses, is if you've managed to culture the Nocardia.
Right, the definitive diagnosis.
Because then you can do antibiotic sensitivity testing. Basically test that specific bacteria against a range of antibiotics in the lab to see which ones kill it most effectively.
Tailoring the treatment.
Exactly.
Right.
But obviously you often need to start treatment before those culture results are back, or sometimes culture isn't possible.
So what are the go-to drugs then?
Good first-choice options often include sulfonamides, sulfa drugs, things like sulfadiazine used at specific dosages, or, very commonly, combinations of a sulfonamide with trimethoprim.
Okay, sulfa drugs are a mainstay.
They seem to be, yes. But there are other options too if those aren't suitable or sensitivity testing points elsewhere.
Like what?
Other classes mentioned include aminoglycosides, drugs like gentamicin or amikacin, tetracyclines, or another group, doxycycline, minocycline, and erythromycin is also listed, sometimes in combination with other antibiotics like ampicillin or amoxicillin.
So quite a few possibilities.
Yes, and for really serious infections, especially maybe if you're waiting on culture, the source mentions that combining amoxicillin or ampicillin with an aminoglycoside can sometimes have a synergistic effect, work better together.
Okay, so a range of choices, ideally guided by testing. How long does the treatment usually go on for? You said weeks or months.
The average duration mentioned in the source is about 6 weeks. But, and this is a really critical point they make, treatment should continue for several weeks beyond when the animal seems clinically normal, beyond apparent remission.
So when they look better, you keep going.
Yes. Because this bacteria can be really persistent, hiding out, you need to ensure it's fully eradicated to prevent relapse. Stopping too soon is a risk.
That makes sense. 6 weeks minimum, maybe longer, and continue well after they seem recovered.
Mm-hmm.
Are there any particular worries with these drugs? Side effects, interactions?
Yeah, there are a couple of important caveats mentioned, especially concerning cats.
Nope.
With tetracyclines in cats, sometimes they can cause a drug-induced fever. If that happens, you need to stop the tetracycline.
Good to know. Anything else for cats?
Yes, the sulfonamide-trimethoprim combinations, while effective, can cause problems in cats if used long-term. There's a risk of anorexia, loss of appetite, and potentially a serious, irreversible suppression of the bone marrow.
Oh, that sounds bad.
It is. So to try and mitigate that risk, the source recommends supplementing with folate when using these drugs long-term in cats.
Folate supplementation. Okay. Important considerations there. So let's say treatment goes well, the pet recovers. What's the long-term picture? Is that it, or is there follow-up needed?
Definitely follow-up needed. The source advises careful monitoring for potentially up to a year after finishing treatment.
A whole year. Why so long?
Because there's a risk of late complications or relapse, especially involving the bones or the central nervous system, which might not show up immediately.
Ah, so the infection could potentially linger or reappear later?
It's a possibility. So vets and owners need to keep an eye out for any returning signs: fever, weight loss, maybe seizures if the CNS was involved, breathing difficulties, lameness suggesting bone involvement. Vigilance is key for that first year post-treatment.
Okay, so long treatment and then long monitoring. It really underscored how serious this can be.
Well, this has been incredibly informative. Just to quickly recap then, Nocardiosis, it's this uncommon but significant infection in dogs and cats, caused by bacteria hiding in plain sight, in the soil.
Right, and it can look very different depending on where it hits skin, chest, or spreading throughout the body.
Making diagnosis a real detective story, needing careful investigation, imaging, looking at samples, and ideally, that culture confirmation.
And treatment is a marathon, not a sprint. Long-term antibiotics,
Sure.
sometimes surgery, good supportive care.
And careful follow-up even after they seem better.
Exactly. I think the real aha moment here, for me anyway, is how something so seemingly ordinary, just dirt, can pose these complex health challenges. It really drives home the connection between our pet's health and their environment.
It really does. And for you listening, we hope this deep dive has achieved our goal, giving you a solid, clear understanding of nocardiosis, pulling out the key insights from the medical overview without getting lost in the weeds. Yeah, hopefully it's been useful and, maybe a bit surprising too.
It definitely makes you think, doesn't it, about that interconnectedness you mentioned. It leaves me wondering, what other everyday things, seemingly harmless elements in our environment, might hold hidden risks for our animals, or even for us?
That's a great provocative thought. It encourages a broader perspective on environmental health and its impact, doesn't it?
Absolutely. And if any particular aspect sparked your interest today, maybe antibiotic choices or how the body reacts with those granulomas, we hope we've given you the terms and concepts to explore further if you wish.
Yeah, keep digging, so to speak.
Thanks for joining us for this deep dive.